Hi everyone, welcome back to my YouTube channel. Today we are going to talk about sternocleidomastoid muscle. Talking about the origin of sternocleidomastoid muscle, sternocleidomastoid muscle has two distinct origins as it has two distinct heads, sternal head and clavicular head. The sternum head originates from manubrium of sternum and the clavicular head originates from medial portion of clavicle. Moving forward, talking about the insertion of sternocleidomastoid muscle. Sternocleidomastoid muscle insert into the mastoid process of temporal bone and adjacent portion of the superior nuchal line of the occipital bone. Now we will talk about the shape of sternocleidomastoid muscle. The sternocleidomastoid muscle is a thick strap-like muscle with two heads, sternal head and clavicular head, which converge as they ascend to the skull. Now we will talk about the innervation of sternocleidomastoid muscle. Sternocleidomastoid muscle is innervated by the spinal accessory nerve, that is for motor supply. It is cranial nerve number 11, and with sensory contribution comes from cervical plexus C2 and C3. Now we will talk about the blood supply of sternocleidomastoid muscle. The blood supply of the muscle is from the branches of the occipital artery at the upper region of the muscle, superior thyroid artery at the middle region of the muscle, and transverse cervical artery at the lower portion of the muscle. Now we will talk about the function of sternocleidomastoid muscle. The sternocleidomastoid muscle has multiple roles in head and neck movements. If it contracts unilaterally or it shows unilateral contraction, then it can do ipsilateral flexions, that is tilting the head towards the same side, and it can also do contralateral rotation, that is rotating the head to the opposite side. But if it do bilateral contraction or if it show bilateral contraction, then it can do neck flexion, that is moving the head forward, and it can also do elevation of the head, that is assisting in raising the head when laying down. And it can also help in accessory inspiration, that helps elevate the thoracic cage during deep breathing by raising the sternum and clavicle. Talking about the palpation of sternocleidomastoid muscle, this muscle is easily palpable, making it useful in clinical examination for detecting abnormalities like lymphadenopathy or vascular issues. Now talking about the clinical relevance of sternocleidomastoid muscle, torticollis is also called as ray neck. It is a condition involving abnormal shortening, spasm or excessive contraction of sternocleidomastoid muscle, leading to tilting and rotation of the head. Its causes include congenital abnormalities, trauma, or nerve injury. The second clinical relevance is trigger point. The sternocleidomastoid muscle can develop painful knots or trigger point, causing referred pain to the face, head, or ear, and it causes problem in diagnosis. The third clinical relevance is accessory nerve damage. Injury to spinal accessory nerve can result in weakness or paralysis of sternocleidomastoid muscle, and that's how it can affect head movements. Thank you for watching. It's all about sternocleidomastoid muscle. If you want video on any topic, you can comment, and if you liked your video, don't forget to share, subscribe, and comment. Thank you.